Now we come to the reason why we are here today, the proposal. And we will share this presentation together, myself and Raffaella. This proposal was already presented 2 years ago in London when Mark Offenbeck organized a seminar on research on open dialogue. And the idea came a few months prior in Norway when Mark Offenbeck, again, presented the Odyssey structure, Odyssey proposal in the annual meeting on psychosis. At that time, it was in Norway. So when I saw the Mark Offenbeck's presentation, I thought to myself, oh, that's so good, so huge, so big, so ambitious. And it is exactly what is in the mind and the ambitions of many researchers around the world, including myself and Raffaella, and who naively, very naively, in 2014, we started with promoting open dialogue in Italy. And we started promoting open dialogue for different reasons that were in the background. I do not want to come in that detail. I have omitted to introduce myself. My name is Guiseppe Salamina, as you've seen. I am a public health officer. I'm not directly involved in mental health care. I have the responsibility of public health in Torino. And my opinion is that mental health and mental health consequences are part of public health responsibility. That is why I have committed myself in this initiative. Saying that, I just want to explain why we are here now after this long journey through the years and through this incredibly amazing and passionate network of people working in open dialogue. So in 2014, I promoted the introduction of open dialogue in mental health services in Italy. And as in many other instances, to receive fundings, I was in a way obliged to design a research study. Otherwise, the Italian Ministry of Health would have not given any money for that. So the two ambitions were, first, to introduce open dialogue in mental health settings in Italy. The second ambition was to design a research project. And of course, for my training in public health as an epidemiologist, as a training in biostatistics, I'm a very quantitative person. I designed not a randomized control trial, but a comparative matched control trial. So I proposed to the Italian Ministry of Health to have two different districts, two different catchment areas, in which one would have taken enrolled patients with treatment as usual, compared to other districts in which open dialogue would have been introduced. It was very ambitious because at that time I only had a very quick telephone call with Jaakko Seikkula, and we were not really aware about how difficult, how complicated, how so hugely resource-consuming is to start the training, to train people, to assess quality, to monitor things, to ensure comparability of quality and skills in working with open dialogue and with dialogical approach. So all those challenges were totally underestimated, but we were obliged to make research for funding purposes. So to come to the Mark presentation in Norway in maybe it was 2016 probably, I said myself, oh, it's a great opportunity for many of those of myself around the world who are attempting to commit to make research, to commit to produce evidence of efficacy with open dialogue, to stay connected to that. And this is more or less the core idea. So, as the slide says, the context, the background for pursuing this ambition is that many countries, many teams around the world have already capabilities to work with open dialogue, to work with a dialogical approach. They have already started the training. They have maybe heterogeneously, but many have already quite a long experience with open dialogue. And so the idea of producing evidence is that, as Jaakko has already mentioned in his presentation, one of the criticism was critics on the methodological approach to research, no comparative group, no randomization. Many of those tools, of those standards for the scientific acceptance of results were not there. And also, another issue was related to the very localistic, specifically geographically isolation of those results in very small part of the world, like Western Lapland. So, for all these reasons, I was like illuminated, sort of inspiration from this being aware that UK was invested this huge amount of money in this so ambitious, as you have seen with the presentation of Russell Razak and Steve Pilling. There is already someone who is performing that. So it was not necessary that others may repeat that effort. So, what was the initial proposal? Was to design a multi-center study in order to include, in order to enroll, to involve those who are eager to start research on open dialogue, involve them in a multi-center research by exploiting, in a sense, the results that are about to be produced in a unbiased way by the UK study. So by avoiding all those efforts, all that, all the effort also in looking for resources needed for this type of studies, but in a sense use results from ODESI studies and make advantage of ODESI. So we proposed this multi-center international study, and I would like to borrow an expression of Russell Razak when we discussed together about a possible collaboration on this research. He said to me, "Oh, this is a kind of a hub and spoke project where the hub is the ODESI results, and the spokes are these multi-center teams around the world who are connected to ODESI. Connected will mean to have a simplified, a reduced, a less challenging protocol, but still using some of those tools included in the protocol of ODESI. So, stay connected to ODESI will mean exactly this: to use results from ODESI, to use same tools in order to produce comparable results to ODESI, and on the same time to use, so same definition, same outcome, same procedure for enrolling people. And this is something that should be discussed in the next months. And Raffaella will explain you what is, I will stay only on the general principle, but Raffaella will enter in more detail on how we think to organize things in next months. But the idea here is to have a reference study and to provide the study with what Jaakko was mentioned in his presentation in order to provide to this central study the external validity. All those information that all the centers around the world may provide on the contextual factors that could affect the reproducibility and the generalizability of Odessi results in other contexts. So on one end, we will produce the same results by same tools, same indicators, same standards in order to exploit the internal validity of Odessi study, but at the same time enrich with contextual information that could affect the generalizability and external validity. I hope that what I've been said was more or less clear, but there will be maybe some discussion and question in a moment. One of the major points I would like to raise is we will not ask to teams that will be enrolled, and we will show how we think to enroll these centers. We will not ask to any of them to perform a comparative analysis. So we will not ask, this will not a requirement to produce matched areas comparisons. So we will not ask to anyone to make comparative analysis to treatment as usual, because this would increase difficulties and challenges for teams on the field. And we will not ask any randomization. But in order to control bias, selection bias, in order to control critics like, okay, you have collected the easiest, the most favorable cases, in order to control this type of selection bias, we will assess an appropriate period of enrollment in which any request of help will be taken into account and treated with dialogical approach. Of course, this is not simple because there will be a lot of heterogeneity that we have to control, but this could be controlled afterwards, a posteriori, by breakdown patients and clients, dividing them according to standards uses for describing cases with tools used in the protocol. So this is more or less what I mean when we talk about to use a simplified version of Odessi protocol. Of course, this is also a very ambitious project. It's a very ambitious proposal aiming to include in the next 3 years, probably not more than 5, 6, maybe center teams around the world. But one of the challenges related to that is that we will use to avoid to invest too much resources, because a multi-center study normally requires a lot of money, a lot of financing for training, for controlling things, for collecting data, etc. We will, again, as we exploit the opportunity to have ready-made results from Odessi, we will also exploit already ready-made capabilities from teams. So teams around the world who are already mature, who have already developed experience and capabilities and skills with dialogical approach, have been trained for years in their at local level with their own resources, working with their own resources, all this will be exploited. So we will ask two teams to participate by co-financing this proposal with their own work, with their own resources, with their own local resources. Of course, we will provide central facilities. We will provide central coordination capacities from our side. But the general idea is that we cannot afford to train new teams, new sites, new professionals. We need to use those who have been already trained, who are already mature. And the second idea, so this is in general the main objective of the study. Yes, the main general goals. But a second goal, and Raffaella will come in more detail in this, and I have to admit that this is more my favorite one among the two, between the two, is that one of the ambitions of the project is to consolidate, to strengthen the international network, thanks to this research opportunity, to offer teams around the world to stay connected, to receive tools, to receive opportunities to improve the quality of their work, to receive tools to evaluate their daily and ongoing capabilities. And that is exactly what happens in my context in Italy. We started with the Open Dialogue training. We started with the research, even if in a very naive way, but the research gave us the opportunity to evaluate ourselves, to be more conscious about our limits, our capacities, and so on. So this is the second major, not secondary, but another main objective of the project, to offer capacity, to offer opportunity to all those who want to stay connected to this network of people. Please do not applaud, and Raffaella will continue. No, no. Come on.
Thank you, Giuseppe. How much minutes we still have? 10, okay. Okay, I just will enter more in the detail of how we are going to achieve these goals. So the first goal, as Giuseppe explained, will be to test OD feasibility and effectiveness in various mental health contexts with a multi-center study linked to ODESI, and the second one will be give scientific support for the Open Dialogue learning community. Open Dialogue learning community for us means includes researchers that are trying to understand more and assess this practice, includes clinicians that are learning this practice and using this practice, and includes peers, family members, people that want to learn more and participate in network meeting. So Giuseppe explained a bit some preliminary idea we had about the protocol. Maybe it's worth to stress the point that the protocol will be defined together with the advisory board during the first 2 years of this, during the preparatory phase of this project. So, at some point we have established, and we would like to have a study that has a longitudinal study design. We will use a streamlined version of the ODESI protocol and some selection of ODESI measures. In the afternoon, there will be a group that will already started to work on these issues. And we think that Open Dialogue can really enhance the generalizability of ODESI results. We can try to produce use similar measures in different contexts, different services, different cultures. We are very much inspired by the naturalistic research design used in Western Lapland. Is much more similar to what we are trying to do also in Italy. So we will try also to, as Giuseppe said, to stay connected with Odessi, but stay also connected to this idea to make research following clinical practice and not vice versa, clinical practice to be adapted to research. So how, what does it mean to give scientific support for the open dialogue learning community? First, we would like to map the center currently adopting open dialogue across the world, describing them, especially for their organizational capacity, because we really agree with the point Steve stressed in the morning that the organization is the basic of the open dialogue. And this is also a very important lesson learned in the Italian project. The teams that are continuing working are the ones that receive some organizational support from their chief. And in the other team, even if they have very good clinical capacity, they are very disempowered by the lack of organizational possibility to work. We would also like to promote the equality in assessing fidelity in different contexts. This was my personal challenge in the Italian project. I started to do a 3 years training in London because I was feeling so unable to do this fidelity assessment, and I think this is a very challenging issue. And it's great that we have constructing a so large advisory board that can really help us to develop means to address this important issue. And I think it's also important that fidelity can become something that clinicians can use themselves to improve their practice. And we aim also to develop a common data collection framework to make research results comparable. So in the this will, we would like to define the measure, select the sites that will use all the measures, and then we would like to give advice to all the centers, even the one which will be not included in the open dialogue trial. Anyway, give advice of what kind of instrument they can use in their daily practice to assess their daily practice. And then we would like to promote collaboration among OD researchers. And this is the reason why the third meeting of the International Open Dialogue Research Collaboration will be in Rome next year, and will be one of the main deliverables of the Open Dialogue project in the first year. So we are going to have the work plan breaks in 3 phases: a preparatory phases, 2 years phases, and feasibility study and the longitudinal study. We have the first 2 years are, we can say, are funded in a way, and we are collecting. We are doing project and collecting donation with the foundation to make this project going ahead. So we are here. Actually, this is our meeting today. This is the plan for the first year. The first activity that we will do is a survey. The survey will be sent to all the teams we know that are practicing open dialogue. And based on we will select the one who show the best organizational capability to start in the second year with them fidelity assessment. But also the one which are not yet there, are not yet in condition to practice open dialogue with organizational fidelity, they will stay in contact with the project, they will receive advice about research and stay in contact. And we will, this map that we will develop will be an interactive map. This will be also be one of the first deliverables of the project. And this is more or less the first year, and the second year will be much more based on fidelity assessment. Okay, sorry. And during these years, we will develop the research protocol of the pilot study. And we want really that this protocol can be acceptable for clinicians, can be acceptable for different contexts and sites. Okay. And just a last reflection about some values that we really want that are, we would like that this project is based on this value. We really believe that research can improve clinical practice. In HOPEnDialogue, from the early beginning, this was really something, research and clinical practice were really linked. And we think this is really essential to understand, assess, and improve practice. We also think that OD research has to be inclusive as the HOPEnDialogue practice. And this is the reason why we include different international contexts, expertise, and stakeholders. And then we would like to develop this project with all of you using a collaborative research framework and shared leadership. I think this project, and then I close because I know we have just a minute, is only possible because of the collaboration of the people that are in this room, the collaboration of an advisory board that includes 20 members, researchers, clinicians, trainers, peers, family members, experts in public health, representative of the foundation that is financing the work. And also, I think there are also the OD teams from 4 continents that are interested in joining the project are already there, because many of you are clinicians of teams that would like to join the research, and others are online, just participate online to this meeting. So I think without this collaboration, this project is not feasible. But since we have all these forces together, I think the ambition can be realistic. Thank you.